Welcome, Professor Madhuwanthi Dissanayake. I think we met much earlier, a couple of years, when we had our Delhi Ophthalmic Society meeting at Sri Lanka. Nice to have you with us. And over to you, ma'am. You are the chairperson of today's session. And she will be talking to us on computer vision syndrome and its effects on the eyes. Over to you, Professor.
Thank you very much. Let me share the slides. So good evening to all of you. And at the outset, I would like to thank the AIOS for giving us this opportunity to join the International Ophthalmic Conclave of 2022. So my topic is effect of computer vision syndrome on the eyes. I have no conflicts of interest. Computer vision syndrome, as you know, is a group of vision-related symptoms resulting from prolonged computer and cell phone use. And its importance is highlighted due to the online learning and working environment spiked by the COVID-19 pandemic. Worldwide prevalence ranges from 60 to 80%. In a recent study we conducted in our country, actually we conducted a similar study, and the prevalence rate was actually 63.5% with 231 medical undergraduates. So the common symptoms include eye strain, headache, blurred vision, as you know, as well as joint pains. But this constellation of symptoms range from the ocular symptoms would range from eye pain, irritation to photophobia and double vision, and the extraocular symptoms would range from headache, neck pain to aggressiveness and sleep disturbances. So from a management point of view, we can categorize these issues actually into four main categories: background and posture, computer related, eye related, and general health. So if you take the effects on eyes by this computer vision syndrome, the work background is important. You have to have a spacious environment with ambient light and ventilation, as well as no glare causing devices in the surrounding. Ergonomics is important, where the posture is considered. So for a proper posture, we have to have the seating arrangement properly aligned with the computer screen. So as you all know, the back rest is important, as well as the adjustable height is important. And the distance from the eye to the screen is around 2 feet or arm's length away. And the screen should be at the same level or a little below. The other thing is actually the arm rest should be there to support the forearms and wrists. The computer-related settings will include the anti-glare screens and other settings in the computer. So as you all know, the settings in the computer can be adjusted, such as enlarging the font size, as well as having a good background where the contrast is maximized. And you should avoid any busy backgrounds and low contrast backgrounds. Eye muscle fatigue is also very important, because with constant focusing at near, not only the ciliary muscle, but the sphincter muscles in the iris, as well as extraocular muscles, such as levator palpebrae superioris, will be affected due to incomplete and infrequent blinking. So to overcome all this, as you know, the famous 20-20-20 rule is important, as well as blinking and ocular exercises during these breaks at every 20 minutes. Dry eye is another important component, where the patients have to be diagnosed and treated when necessary. As well as the other factors that contribute to dry eye, which is common, such as blepharitis, has to be treated. uncorrected refractive errors, even though small, can be very important, not only for presbyopes, but for all the other age groups. Not only that, the general health, adequate hydration and adequate nutrition, including vitamin A, C, and proteins, and regular exercises and relaxation is also important to reduce the effects on the computer vision syndrome on the eyes. So up to now, we have discussed about the effects on the two visual eyes. But there is also another interesting gland which is located in the epithalamus in the diencephalon, which is also known as the third eye. And the effects on this organ is also important from the computer vision syndrome. Actually, the third eye is a direct light sensing organ in the reptiles and amphibians. But when it comes to humans and other mammals, it is the pineal gland which secretes melatonin, which is the serotonin, a neurotransmitter, acetylated and methylated into melatonin. So this melatonin production is influenced by light, and it regulates the circadian rhythm and the seasonal rhythm. So the secretion is maximum at during dark times, and it rises very rapidly. So what is the effect from the computer vision syndrome? The LED back panels in the devices will have blue light, which is maximally sensitized by the pineal gland, where the melatonin secretion is reduced. So this effect can be the cause of restlessness and sleep disturbances in computer vision syndrome. The jury is out on actually finding out whether the blue blocking glasses are having an adequate effect in this regard. So until that time, we have to be aware of these things and be careful and avoid the effects on the eyes by using this checklist. So this is a checklist developed by us. Be smart for your eye health. B is for background, E for ergonomics, S for spectacles and tear supplements, M for modifications of the computer, and A for adequate hydration and nutrition, and R for regular breaks to reduce eye muscle fatigue, and T is the time you remember about the melatonin. So in conclusion, I would like to state that increasing awareness on CVS will help to reduce the symptoms and will increase the productivity of the workforce and effectiveness of teaching learning programs of students. So as ophthalmologists, it is our duty not only to treat the patients, but also to take part in advocacy for promoting healthy practices in using digital devices in this virtual age. Thank you for your attention, and I would like once again to thank the AIOS for giving us this opportunity to take part in this important event. Thank you.
Thank you so much.